I never thought I would want to work in the medical field until I had an experience that changed my entire outlook on it. Growing up, I did not like going to the doctor. I was always nervous and I dreaded the appointment the days before. In 8th grade, I sprained my ankle playing tennis, and after avoiding the doctor for 2 months, I eventually went. He referred me to a physical therapy clinic, and my insurance had approved 12 weeks of physical therapy, which to my mother meant you're going for 12 weeks. On the first visit, I was nervous, scared, and I knew that it would hurt doing the exercises. However, after the evaluation and some stretches, I felt great. So I kept going. Eventually, I realized that the doctors weren't there to cause me any more pain and were just there to help me. I grew a deep appreciation for them because tennis was such a big part of my life that them helping me meant getting back to tennis. I then realized a career in physical therapy would align greatly with my values, as I love movement, I love exercise, and I also love to help people. The thing that stuck out to me the most wasn't the way the physical therapist treated me, but the people that they were treating. It was a clinic in Mesquite, small, in a strip mall next to a Rio Grande behind a Krispy Kreme. To me, physical therapy has always carried the connotation of expensive, private insurance, fancy offices. But this humble clinic was treating people who were just like me, on government insurance, low income. So I knew for sure that these doctors were not making as much money as they could be. Yet they were still there, showing up day after day, treating people in and out. As I worked my way through college, I have one clear. I want to help people no matter what their financial situation is. I plan on being accessible. Eventually, I want to have my own clinic. I want to establish a practice where people can use either government issued insurance or pay affordable rates for their health. No one should have to live a life full of pain. With physical therapy, it's a bit harder to provide care for people spontaneously. It's not like I can go to a health fair and assess people or prescribe things. I have to do an evaluation. So I plan on having days of the week where I can provide treatment for free and have patients repeatedly visiting me so we can track their progress and tailor their treatment plan to their individual needs. I also plan on attending health fairs and educating people on injury prevention and maybe doing some evaluations to then take them on as a patient or refer them to someone else. To be able to do all this, I will have to finish my bachelor's in kinesiology and eventually enroll in a doctoral program of physical therapy. I plan on either attending Texas Women's University or the University of North Texas Health Science Center. I'm thinking of taking a gap year if need be to obtain a commercial driver's license and save up enough money if I don't get enough grants. Once I finish the doctoral program, I'd like to enroll in residency, and eventually, as the years go by, I want to enter a postdoctoral fellowship program to receive a doctoral degree in orthopedic manual physical therapy. Throughout my life, the biggest challenge I've had has always been finances. Coming from a low-income background, I knew I had to excel in school to be able to get scholarships and get an education. Thanks to God, generous donors, and hard work, I'm currently attending Texas Christian University on a full tuition scholarship and a generous financial aid package that covers most of my housing and food. However, college is expensive, so I have been working at Best Buy for the past 2.5 years. Balancing school and work has been difficult, but I know that tough times create tougher people, and eventually I will be grateful that I've worked so hard to build the future that I am doing for myself. Receiving the scholarship from IMME BECAS will relieve me some of the financial stress I currently have to help me buy books and pay for the remaining semester's housing. In all honesty, I have been blessed with an opportunity that I never imagined myself having. One day, I hope to return the favor to my community who has always supported me and to my family.